9 cases of the dengue fever has been confirmed in the eastern region of Ghana following the unusual detection of clinical malaria cases in several districts which were unresponsive to standards anti-malaria treatments. There's more on the following reports.
It's a viral infection transmitted to humans through the bite of infected mosquitoes. The disease is an acute fever caused by a virus through the bite of an infected Aedes aegypti mosquito. The Aedes aegypti is a known vector of several viruses including yellow fever virus, dengue virus, chikungunya virus and Zika virus, which bites during the daytime. Presently, the Ghana Health Service has confirmed 9 cases of the samples were sent to the Noguchi Memorial Institute for research. The Ghana Health Service has further sent a directive to all regional health directors of health service and chief executives of teaching hospitals to disseminate this alert to all health workers within their regions, districts and hospitals, including mission and private facilities, to create awareness. This measure is intended to enhance surveillance of the dengue fever and ensure that all clinical malaria cases undergo laboratory confirmation. A team from the national level made up of entomologists and epidemiologists have joined the regional team to undertake a detailed outbreak investigation.
To Dr. Thomas Anaba. He is Executive Director, Africa Center for Health Policy Research and Analysis on the dengue fever outbreak. Thank you, Doc, for your time. You're welcome to Newsbeat. Good afternoon.
Good afternoon to you, and good afternoon to your cherished viewers and listeners.
That the news is going really viral. How dangerous is this fever?
Right. It will be dangerous because some few patients who fall victim to it may have some manifestations that we call hemorrhagic bleeding carelessly from all parts of the body, and then go into shock, whereby their blood pressures would fall so low and will require serious intensive care management to recover. So that is how dangerous it is. But majority of people could have symptoms that can be managed at home.
Bleeding,
so it's a dangerous disease.
So bleeding from any opening of the body?
Yes, that is the most complicated forms of it. As I'm saying, many of the people who fall victim to the virus will have symptoms that can be managed at home with paracetamol, hydration, eating well, and they will recover without much problems. But few of them would end up having bleeding from the nose, bleeding from the skin, coughing and bringing out blood, even bleeding into the joints of the body. And even tying a tie around your body could cause something we call chemosis, or patches of blood around your body. So that is why it can cause. As it causes you to bleed from other parts, it will reduce the blood volume in circulation. That will lead to what we call a shock. And that will require an intensive care management to transfuse your blood with blood components and clotting factors to enable you to survive. So it is a risk, a very high risk, simply because it is transmitted by a mosquito which is available in all parts of this country, meaning that somebody can pick it today in Accra, travel to Boku tomorrow, and spread it to people in Boku. So controlling it is very, very important. And whatever we can do to control all those who will be suspect, to stay put so that they will be monitored till the latent phase would disappear, we have to do it.
Does it require isolation? Should you, get infected at, the most serious level?
It requires some amount of isolation, not absolute, just like the coronavirus. This is, if they isolate you and you are sleeping in mosquito nets, the other people sleeping in mosquito nets, yes, you can move around. Where there is those mosquitoes, we can be together and live our normal lives. But where we suspect that there are breeds of mosquitoes, we have to be careful for the mosquito not biting one person and moving to the other. If any of them within the group there has the dengue fever, the mosquito could transmit it from one person to the other and spread it. But it doesn't require that type of isolation like the quarantine in coronavirus. No, it doesn't. It requires preventive measures. People should use repellents in their bodies when they are going out. People should sleep in mosquito nets. People should ensure that mosquito breeding around their houses, whereby you have stagnant waters and they are taking chance to breed, we pour away those stagnant waters and then fumigate the areas to prevent the mosquitoes from breeding. In that way, we'll be able to control the spread of the dengue fever.
Can you confirm if these mosquitoes indeed bite only during the daytime? And are they a new breed of mosquitoes?
Yes, they really bite during daytime. Hardly do they bite in the night. So it means that daytime mosquitoes are those that will really cause the transmission. So we should go to places that have less mosquitoes, and we should use mosquito repellent to prevent the mosquito from getting to our skin to bite us.
They are a new breed of mosquitoes?
No, they are not a new breed. They are existing mosquitoes already. They are in the system already. So I think what we need to do to prevent it is to make sure government find measures to do what we call a biological elimination of this type of mosquitoes. And that is what exactly was done in countries like Cuba. That is what Cuba was trying to do in Ghana by setting a labiofarm to produce this type of bioagents that would divulge all these type of mosquitoes that would spread malaria and other diseases related to using the mosquito as an agent of transmission. So they really bite during daytime, and they are an existing type of breed already in the system.
So can we chip this idea to the Ghana Health Service and see how far we can push?
Yes, I think for a long-term prevention, we can bring it up to government. And I think under Atamils and John Dramani Mahama, there was an attempt to set up a labio farm by the Cuban government in Ghana to eliminate this type of mosquitoes, because they have succeeded in doing it in their country and they were trying to replicate it here. We could fall back to them to see what agreement we can have with them to see how we can minimize not only dengue, but even malaria. We could reduce the incidence of malaria and reduce the costs and the economic effects of malaria caused by malaria. So let's call on it. Let's fall back onto this agreement and see whether we can develop the bioagent laboratory to eliminate this type of mosquito in our system.
Right, Executive Director, Africa Center for Health Policy Research and Analysis, Dr. Thomas Anabave. We're grateful for speaking to us here on this new development. Protect yourself from mosquito bites. You might not be able to tell the difference of the breeds. You're also watching Newsbeat here on Metro TV. Time for business.